So, good morning, everyone. My name is Dr. Oyadiran, and I want to talk to you about social isolation in the elderly. When we talk about social isolation in elderly, you can go to the next slide, please. When we talk about that, we talk about loneliness and social isolation. But social isolation is an objective condition where we are not able to go out to other and meet with other people. So you're physically isolated from someone. Loneliness is a subjective and it's more of a feeling. Go to the next slide. And so when you have loneliness, there's craving for social contact and linked with feelings of sadness. It can have negative impact on both physical and mental health, cardiovascular disease, stroke, and it increases stress levels. So it can increase blood pressure, and sometimes loneliness can lead to death. But it's a state of mind. Next slide, please. As we talk about isolation, we are talking about a state of complete or near complete lack of contact with individuals and society. It differs from loneliness because it is a temporary lack of contact with humans. And during the pandemic, we saw that seniors had this for multiple reasons. One, they were at higher risk for developing COVID. And second, if they were not able to travel due to transportation or immobility, it created that distancing from other human beings, their family, because they did not want their family members to get sick. Why is it important? What's the difference? Well, isolation, people can experience loneliness, and that can affect self-esteem, that can affect many different areas. And people experience anxiety or abandonment, or they lack social professional relationships. So another time where people become isolated or they change suddenly is a death of a spouse or a change of job situation, someone retiring, and now they have to find another way of identifying. Next slide, please. If you look at this slide was developed as a result of a research study. And what they found that in red, social isolation and is more deadly or more affecting negative effects to health and mental health than smoking, than high blood pressure, than obesity, and that these cause more morbidity and mortality. So it is important that we monitor and identify patients or individuals that are socially isolated who have chronic disease, because this can compound the problem and it can cause more challenges to these individuals. Next slide. So when we look at factors impacting social health, one of them is social connection. And one thing that we can say quantitatively about it is that it's marital status, whether or not they have family members, whether or not they have friends or community that can help to, and the frequency of these contacts. If no one knows this patient or this person and they are living alone and they live in isolation, those are some of the sad stories you see where people have been in their home for months and nobody knows what's happening with them. Loneliness, as we look as the qualitative, as we said, subjective, it is perceived lack of intimacy. And this can also cause some negative health impacts to cardiovascular disease, stroke, dementia. So we've seen in studies from the NIA that when patients are lonely, they have more chance of having depression and suicide. So it is important that we identify this in our patient population. So depression, poor sleep quality, and acceleration to cognitive decline have been found, as well as decreased immunity and cardiovascular function. So these studies are over and over showing how the impact of social isolation has not only on mental health, cognitive health, but also on cardiovascular function. Next slide, please. So let's talk about this again. When we talk about loneliness, we know that it can lead to premature death and from all causes, equal to smoking, obesity, and physical inactivity. Social isolation leads to 50% of increased risk of dementia. Poor social relationships are associated with 29% increased risk of heart disease and 32% increased risk for stroke. Loneliness was associated with regular rates of depression, anxiety, and suicide. And among patients with heart failure, there was 4 times increased risk of death and 68% increased risk of hospitalization. So 57% of these have more increased ER visits. Next slide. So what can we do? How can we, in our communities, as providers or as family members, try to break this cycle and identify those who are lonely? How do we do that in our medical practice? We do a Lubin scale. We do a study where we review 3 aspects. Do you have someone to contact if you are lone, if you have a certain issue or a problem? Can you talk to someone? How often do you see friends or family? And then lastly, if you needed something to go to the store, did you have someone that can help you in that? So what we've identified is in the Lubin scale, we know that if patients are socially isolated and lonely, they score between 0 and 12. And when they score between 0 and 12, we need to take action. And some of those things are linking patients to resources, community groups. There's many things online, even if the patient cannot leave their home, providing them tablets, providing them ways in which to communicate. The NIA has a slogan called Commit to Connect. It's important to identify people who are lonely so that we can connect them and put them together with other seniors, or make sure that their family members are aware of this and work with not only the patient, but their caregivers to promote a best way to help this patient feel better, exercise, and also develop techniques to counteract some of the negative effects of loneliness. So it's important to identify what are the personal networks for that patient or that person. And even if it's a community church or some type of religious organization that the patient is part of, make sure that we connect the patients to this. Next slide. We can move to the next slide. No, we can move to the next slide. So during the pandemic, multiple studies have been done that show that when patients are socially fragile, they have risk for other psychiatric outcomes, anxiety, mental health, depression. And when we look to the left, when we say that social vulnerability, when people are not able to do what they normally do, if they were going to the gym, if they were connecting in a senior facility, if they were doing something that made them have a sense of purpose, to wake up every morning and to talk to others and to feel connected, it is important that we identify what can we do to help that perceived loneliness, and what do we do to avoid that social media distress that they have when they feel that they have no way or anyone to help them. When we talk about social inequalities, that is another impact that has impacted many of our seniors due to loss of ability to pay for things, to do things that they would normally do, and transportation. So I think that the most important thing here is to look at how the loss of social and general resources is what we need to help them find, is to make sure that we know what are the community resources in our neighborhood, and how in that patient's or that family members, how can we get those psychological improvement to their health. So when we look to the right and we look at the multifactorial psychiatric outcomes of COVID-19, We know that there's a lot of direct effects and indirect effects. Some direct effects had to do with brain viral infection, some cerebrovascular disease, and inflammatory states. And what we know is that this inflammatory condition is what's causing further challenges to the patient's health when they have chronic diseases. But when we look at the indirect effects, we have things that we can do to help with social isolation and loneliness. Finding a pet or having connectedness through social media, connecting online. A lot of things now have changed since then, and we're now more aware that we can do televisits with patients, and they can have televisits with the mental health professionals as well. So concerns and things that we need to do is to help our seniors to avoid social isolation, avoid this feeling of loneliness, and to connect with them frequently. Next slide, please. So at the beginning, the keynote speaker talked about social determinants of health, and this impacts this population as well. Where we talk about food insecurity, where we talk about lack of transportation, financial strain, sometimes homelessness, or problems with utilities. It is very important that we identify this in our patients, in the people that we interact with, who are our family members, to understand what things can impact them and make them more lonely and more socially isolated. Next slide, please. So, as I mentioned, we had more televisits instead of face-to-face visits. And sometimes those face-to-face visits with providers or with their medical professional was their opportunity to have a social engagement, to go, if they're taking a bus, if they're interacting with other people. We are social beings. We need that form of connectedness to feel less lonely. And just saying hi to someone and smiling is even better than just staying home alone and not having any social interaction. So the most important thing is more face-to-face visits, more contact, even if it's audio visual face-to-face visits where they can see another person, communicate with them. And that's another way in which family members communicate with their loved ones via tablet, via FaceTime, or any way in which you can have more FaceTime. Next slide, please. So at Sanitas, what we do is we provide patients with a social prescription. We identify what's happening with their loneliness. We identify, do they have any social determinants of health? What is the solution? How can we help our patients to develop a better way of coping with loneliness, identifying depression, identifying anxiety, forming a community group with these patients, and identifying their way in which they like to do things. So if they liked knitting, put them part of a group that does knitting and sewing and have arts and crafts. They can do that online, they can do that in person, but just finding what is their niche and how to best improve their well-being. Next slide. So what can we do to help? So the best thing for any type of loneliness is to form a group of people that like to exercise and go outdoors, get some fresh air, and be with nature. Connecting safely with friends through tablets, phone, social connections, and also developing online groups. For seniors, they have something called Silver Sneakers. They can do exercises from their own home, but they can also see some people of their own age and own cohort doing the same thing. And connecting over time, they get to know who these people are. And so when someone has severe enough social isolation, depression, anxiety, it is important that they communicate that with their healthcare professional so that they can receive treatment, counseling, and they can learn to cope and learn techniques to help to improve their overall well-being. And lastly, when we talk about relaxing and spirituality, it could be mindfulness, it could be meditation, it could be laugh therapy. There's many ways in which we can help someone to overcome their anxiety of being alone, their sadness, by connecting them with others, and also finding ways to connect on a different level. Next slide. Some resources for some Medicare beneficiaries, they have something called PAPA, and that's a college student who goes to the patient's home. They help them with uh, groceries. They help them remind them of their appointments, and they give them a lot more support when they don't have family members close by, and they check in on them periodically. So they can do that on the phone. They don't necessarily have to be in front of the patient, but definitely they connect with them, and it makes them feel like someone's there for them. And that's the most important ingredient. Having a resource, having someone who cares about you. And that's where caregivers are important, as well as other family members, checking in on their loved ones periodically and identifying any distressors or stressors in their life. And then next slide. So when we connect with seniors, we can use technology. We can definitely do social distancing, but washing our hands frequently. We can do Zumba classes, cooking classes, Facebook and group sessions, book clubs. And what's important also is to make sure that they have a good diet and that they're following some type of exercise program. They can share recipes and share culture when they come together, so that they feel a form of community. And that is the most important part of it, is that sense of community. Next. So at this point, I'd like to take any questions from anyone in the audience.
Dr. Oyadiran, I have a question. Is it to ask? I don't know if you can see us or you're just hearing us, right?
I see.
Okay. One of the things I wondered is when you do that kind of scale that you talked about, the Lubin scale.
Yes.
Does it also, okay, so I have to confess, this is like spoiler alert, because the part that I'm going to do in the next breakout session is how the urban design influences mental health. And you hit on like the key area of this social isolation and how our physical environment really in some cases forces us into an isolated lifestyle. When you do the Lubin scale, do you all evaluate kind of where they live and what their neighborhood characteristics are? Is that part of the scale?
Yeah.
Could you talk about that a little bit? Yeah.
So the Lubin identifies their social connectedness.
Mm-hmm.
It identifies if they have a resource to help them. But we do a social determinants of health in addition to the Lubin scale.
Okay.
Where we look at, do they have transportation? Do they have access to resources? Do they have food insecurity? So asking all these questions and asking their financial status, if they're having problems, if they're homeless or all of those, that helps us to pinpoint what's happening in their immediate environment. So it's the Lubin is not just, but it helps us pinpoint if there are areas that they're lacking because they don't have family, they live alone, or they live in an area where they don't have the ability to go to do certain things because either it's too far and they need transportation. So we tweak out in our health risk assessment when we do their evaluation.
Okay, and not to take up space so other people can ask questions, but just quick follow-up. The part that you do where you sort of assess the social determinants of health, is that like a standard survey that we could look up, or is it just what you do in your practice?
Yes, it is a standard survey. I mean, it could be found on the CDC website. We just modified it so that it could be useful in our practice, but definitely it is something that we do ask that have to do with at least the 6 elements of social determinants of health. So we modified it to make it user-friendly, but we ask specifically, are they having issues with transportation, any issues with food and so forth, so that we know what can we do in preparation to prevent any burdens to care.
Yeah, thank you.
Mhm.
Dr. Oyadiran, what would you say is the biggest barrier to decreasing rates of social isolation?
Well, I think the biggest barrier is not only, I think it's perception of and fear for patients in terms of when we had the pandemic, they were afraid to come out. And so now that we have more precautions and ways to prevent spread of the disease, and we have the vaccines, more people are coming out. But I think the biggest barrier is knowledge. The biggest barrier is knowledge of resources and things in the community that can help them become less isolated. I think that, remember, isolation is a objective, not a self. Sometimes people do it for themselves because they want to be alone, but sometimes people don't know how to get out of that situation. Does that answer your question?
Yeah, that does answer my question. And then I guess sort of like jumping off of that, do most of your patients know that social isolation is a serious issue and they're having trouble connecting, or they just don't know that it's a big problem for them?
Let me see. So some people, they don't know how social isolation impacted them, and they can't pinpoint that that's what the problem. They might feel sad, they might feel depressed, they might feel anxious, but as we tweak out some of these other things, we can find out why, and we can find out, instead of just prescribing a medication, we can find the root cause and help them to separate that from a condition. But the reality is that they are socially isolated and they don't have enough social contacts, which we crave as humans. And so that helps people to thrive and to do better when we have all these social stressors.
Could I ask another question? Sorry, like I
Sure.
wanna I wanna hog this thing, but what Jessica's saying made me wonder. In your experience, do you think Miami-Dade is more at risk for social isolation than other places where you have observed or worked?
Well, there have been studies where they show different areas on the map. And it's not necessarily Miami-Dade. It's anywhere, because social isolation is not just for seniors. It can happen to anyone. And it depends on the level of disability of that person and the needs that they have. When we look at activities of daily living and impact of impaired patients with impaired activities of daily living, that is one of the most frequent risk factors why people cannot become less socially isolated, because now they have an impediment that's preventing them from going out in the community. Dementia is another. And so we can say that with the rise of COVID and some other things that forced people, we saw double the amounts of social isolation and loneliness, but it always was there. So I wouldn't say Miami-Dade, but I say, throughout the United States, we have that issue. And so in Florida, I think that in areas where we have multiple families, multiple generations, it's less likely because they have the support. But where we have people who just retired, lost a loved one, then you'll see more pockets of that aspect for loneliness.
Doctor, may I ask a question? I'm sorry,
Sure.
I'm not camera. If isolation exists without the feeling of loneliness, does it have the same kind of impact?
Yes.
With depression, anxiety, and
so
yeah.
yes, it does. It can, because they've done studies. The National Institute on Aging have done studies on both, but they can't pinpoint because remember, the subjective versus the perceived. Objective is social isolation, where they are forcibly out of connection with other humans and other people, which is leading to the loneliness and the perceived sadness. But if someone is still within social isolation and is still communicating online or having FaceTime with their family, then less likely will they be lonely. It's not always the same. But if they are both socially isolated and not able to have that connectiveness, then we tend to have more negative impact on their health. Does that make sense?
Well, yes, it does. But I find that there are people who choose to have that loneliness and isolation, but don't have the emotional impact. I'm wondering if it has that impact on their physical health as well. Do you understand what I'm trying to say?
So they might, and that's the reason, because they might have the social connection, they have the support. You can feel lonely among your own family.
Mm-hmm.
It is that because loneliness is a perception. It is a feeling that no one's hearing you. It is a feeling that you're alone, even though you're in a crowd. So loneliness can impact someone who is not socially isolated. It is also related to depression and anxiety, because if they have increased sensation of loneliness, then it impacts other factors that cause inflammation and distress, and then more issues with their chronic condition. But with social isolation, if some people live in hermit, like they don't want to live around other people and they isolate themselves up in the mountains, and they're healthy, they're physically active, they have no other issues, they might not have any problems.
That's what I'm saying. So it is the loneliness that really impacts it more so than just the isolation.
Yes, but if you have a combination of both, it makes it worse.
Sure, thank you.
Mm-hmm.
But just to follow up on that, your point that because I saw that you showed the whole Lancet study, which is super important. And one of the things they found is all things being equal, right? Like all things being equal, predicting mortality 50% more likely with people who are socially isolated, regardless of your mental health state. So I think, right, there is an impact, whether you, yeah.
Mm-hmm.
Like it's not good for us, right, Carline?
It isn't by any chance at all. And so earlier this week, I was looking at an NIA podcast from Dr. Simmons, and she is a psychiatrist and also a mental health professional with neurobiology and all that. And she definitely said that we are human creatures and we crave connectiveness with other humans, and it affects our ability to thrive and affects our ability to live productive lives. So it is important to have that connectiveness.
I have a question regarding, we've seen the rise of telehealth visits and more connectivity, people knowing how to connect via video. Is there a difference between the benefits of being very socially connected online versus being socially connected in person?
I guess it depends on a few things. One, how old is the individual and how technically savvy the individual is in doing those connections. So if you have an elderly person who's demented and does not understand how to do that, it's not going to be advantageous. This is where we need the help of the caregiver, the family, to help to connect the individual. But then at the end of the day, the interview is not with the individual. It is really with the caregiver. And so it is important that in those cases, those patients come in so that we really can assess and know what's really happening with them. When we have a lot of our patients are younger seniors in their 60s, earlier 65, 68. They are still working and productive. They know how to use technology. And therefore, in that way, it helps them to continue to be productive and have their intervention with their provider and then go and continue with what they're doing in their daily lives. When you say It has helped, but in some cases, it still is not a replacement for that face-to-face interaction with the staff, interaction with the provider, and feeling that when they go to a facility where they know everyone there, someone recognizes them, someone talks about their outfit or something, and they feel good. That form of connection is not there in a televisit. It's just clinical. And so one of the things that, and you can't touch or feel or have that human connection in a televisit. You can try as much as possible to smile and to have a good interaction, but it's not the same as that face-to-face visit, if that helps to answer your question.
Thank you. Another question I had was, it seems to me that the person experiencing social isolation is only half of the equation. So even though you're having that interaction with them as your patient, how do we reach other people to try and bring them into the fold of the community and more social connection?
So this is where it's important that you have an outreach team as part of your organization that goes out and makes these connections with YMCA, the vendors for the food bank, Publix, or wherever it is, to try to work together in a collaborative effort to improve how patients can communicate with their own community. It's about community. It's not necessarily about just the patient. It's about the patient feeling that they have community support. And so by going out there and reaching out to different aspects of their community, they can then know they can do the exercise at the Y. They can do their silver sneakers. They can get food at a lower cost or a lower rate, or we can deliver the food through the food bank to their home, and they don't have to feel anything about it. But knowing what that person needs and trying to find the solution that is right there in the community. So yes, important is to know what are the resources that are out there and how to leverage them and how to improve the deficits that we have currently.
Thank you.
Mm-hmm.
We still have about 10 or so minutes left available for questions, so I just wanted to give everybody an awareness of that.
Okay.
It's a very quiet crowd.
Let me ask a quick question, or maybe make a quick comment. I don't know if you can hear me well. My name is Whitson Faustin. Given the fact that I have an elderly mother and mother-in-law also, that topic really I've taken interest in this topic. I would like to ask a question. What's a practical way we can help our loved ones, elderly, feel connected to us, although we might be living at distance?
So there are, yeah, go ahead. I'm sorry.
What's a practical way we can feel them like they're still connected with us?
Do you call them? Okay. Do you have constant conversations with them on a weekly basis, where you can call them just to check in, and they know that on certain day at a certain time you're going to be checking in on them? Do you have maybe a tablet that you can give them that you can set up and find out what community resources they have, and then they can just press a button and they can connect with that group online to have exercise, nutrition, or different things? So when you find what is it that they like to do, and also find out, do they exercise? Do they go out and do any type of exercise? Who are their friends? Are they meeting with them regularly? Because if they are at a distance, you want to know who's around them and who you can befriend and know if something happens to them, how can you connect with your mom or your mother-in-law? Are they, and knowing their social community, you can also influence how they are, and they have an activity every day, so that they have a calendar and they know that today I'm going to be meeting with Mr. Smith and tomorrow I'm going to be going to the gym. So I think it's important that when you know what they like, and you can talk to them and find out what types of things they do in their daily lives, or what are the things that they may need. When was the last time they ate a good meal? Do they cook? If you go and visit them, what does their refrigerator look like? Do they need special services to help them clean the house? What things can we do? We just have to go and look once in a while and see, what does their home look like? How are they coping? And how are they ambulating or walking or doing anything? Is this a sign that they may fall in their home and that we need to enlist the help of home health or someone who can help them?
Thank you. Thank you for these tips. I think some of these I do already, but I think you offer some valuable insight of what I can do.
And if you go to the NIA website, the National Institute on Aging, they have some elder locators. They have some things that help to identify things that you can do within your community. Also, tips on how to connect elders or seniors with others.
Thank you very much. Appreciate the insight.
You're welcome.
So
Yes.
I just wanted to let somebody else speak.
No. Go ahead.
No. Okay. So I just want to give some instructions for Zoom. We are in the breakout room. So when you leave the breakout room, you are going to go back to the main room. And it's not going to log you out. But if you do accidentally find that you have chosen to leave the session, you can just join back in right with the same link that you originally used to get into the room. And so just wanted to give those instructions so that if you would like, if there's no further questions, you all can take a break before returning.
Hi, Jessica. This is Nikki. I just wanted to let you know that there is a comment in the chat box from Rosa Novo for Dr. Oyadiran. And she's currently at an event and cannot speak, but she said that she is wondering if there are any best strategies on assisting employees that fear returning to work and re-entering the workforce.
Okay, so are you going to relay that information to her? She can't hear?
She said she cannot speak. She's at an event, but she can hear you.
Okay, yes. So the strategies that we can do to help someone in the workplace is, first of all, are they currently working from home? And if they are currently working from home, we need to identify what are their fears, what are their things that they need to understand why it could be safe to return back to the workplace. What are we doing in the workplace? Do you have quarantine measures in place if someone is sick? What are the policies and procedures that you have? When you go to the CDC website, you can see how to prevent transmission of certain diseases such as COVID, monkeypox. And the most important thing is, if you are in a healthcare workplace or not in a healthcare workplace, the most important thing people say is to wash your hands and also to wear masks and to socially distance yourself from others. Use safe hygienic practices. So if the person is not willing to come back to work, the most important thing is to find out what's the issue and whether or not they have received vaccines that prevent them from getting transmitted COVID or anything else, and just identify what is their concern, and then bridge that gap. by having hybrid measures to help them go back to work, and also to identify ways in which we can have a 2-day work week in office, and then finally roll out a 5-day. So it's like in increments, so that it's not a shock, because if someone has been out of the workplace for 2 years, it has changed. But if there's a hybrid that you can come to a solution, maybe that might be something to think about. I hope that answered your question, Nikki.
Thanks,
so
Nikki.
much. Go ahead, Jessica.
I was just saying, thanks for keeping an eye on the chat for me, because I'm not able to see the chat. And then I've received updated instructions. So do not leave the room. The host